So I wanted to take you through, I think, an interesting use case of some real-life public data from the United States Department of Health and Human Services, or HHS. For a while now, I've been watching this site that talks through breaches, which are that release of information of unsecured protected health information, or PHI, that affects 500 or more individuals. And when an organization, say a health system, an insurer, a laboratory company, loses this information through any variety of means, a type of breach like a hack, or through a laptop that gets lost, these things need to be reported to the government, and this site reports on those. Now, the unfortunate part about the site is, as you see on the screen, it's just a lot of tabular data. It's really hard to pinpoint which ones for yourself as an individual, say, are relevant. There's not really a good search method on here. You can use advanced options and kind of whittle it down, but you're not going to see anything jump off the page. You can download this information into a variety of methods, which is actually what I wanted to do to get this into Qlik, and to use the visualizations that we have to give this data a little bit more color and allow you to see maybe how intense some of these breaches are. So we'll flip over to Qlik here. We'll maximize the screen. And right away, you can see I took and pulled in all the information I could from HHS back through 2011 all the way to 2019 just today. And hundreds of millions of individuals have had their health information breached in some form or fashion. You may have heard about a few of these on the news, and this type of information gets out there, and it's often reported to the government and available on HHS before it is breaking news event. So I wanted to give folks a better way to see this, and in particular we'll take a look at where we're at for 2019. And jumping off the page, I used some of the information and the visualizations to show you just the scope of these breaches. So you have Optum 360 as a covered entity, LabCorp, Dominion Dental Services having the largest breaches so far this year. And I used the annotations on the line chart here to kind of annotate some of the larger ones. And I find that's a really great way to make the data talk a little bit more. There are always going to be peaks and troughs, but what are these things? You'd normally have to click through these and then you look at another visualization. So using annotations, we can quickly dive in, and wanted to see what things were looking like in 2019, maybe in the last few months. And you can see, luckily, since these large breaches with LabCorp, Optum, and Clinical Path Labs, I guess, and Memphis Path Labs, have affected millions of people at a time, we haven't had nearly as many breaches in the last month or so. So if we look at August to September, didn't even put in the annotations here because we didn't reach 1 million patients or individuals affected, but you can see some of the ones most recently, and I guess if we just look at September so far, 300,000 people have had their health information compromised in some form or fashion. The primary kind of culprit here being Premier Family Medical. It looks like they are also out of Utah is where that is based. So something that we wanted to note here too was how many individuals per state were affected. Now the way the government reports this is by the headquarters of that covered entity of that health system. So this might not be the best indication of your particular state. I live in Wisconsin, but there are only a few covered entities in Wisconsin. Primarily the health systems are the ones within the states. For instance, I have a different insurer based in a different state, and so they might have been from, say, Indiana, where we have a large number of insurers have been based or have had some very large breaches. So this is the way Qlik and Vizlib can make your data really jump off the page and give you an indication of really the effects of what's going on out there, all using public data. If you want any more information, happy to share this app in some form or fashion. I'll get it out on the Qlik community, and hopefully we'll get this hosted at some point too. Take care.